Acute kidney injury, also known as acute kidney failure, is a fairly common occurrence in hospital settings, affecting an estimated 30% of people in intensive care units. Acute kidney injury has been shown in mice to reduce NAD levels. NAD stands for nicotinamide adenine dinucleotide. It is an energy molecule in our cells. And if NAD levels are also lower in people who have kidney problems, what would happen if you gave people an NAD booster supplement? One such dietary supplement is a combination of nicotinamide riboside, a form of niacin, also called vitamin B3, and pterostilbene, a phytonutrient found in blueberries. The combination of these ingredients is found in a dietary supplement called Elysium Basis, which is quite popular in the worlds of anti-aging and lifespan and health span. So we now have a study of this Elysium Basis supplement and acute kidney injury. Let's take a look at that study now. Nicotinamide riboside and pterostilbene, they're calling it NRPT, increases NAD in patients with acute kidney injury, a randomized double-blind, placebo-controlled, stepwise safety study of escalating doses. So before we go any further, I want to point out that this study, which has this really intriguing name, only lasted 2 days, so this was not a very long investigation, and it was also funded by the Elysium Basis study. And I don't hold that against them, because if they don't study their product, who will? I consider it a good thing when companies do investigate their own dietary supplements. So having said that, what's this investigation look like? Well, we've got 24 people with acute kidney failure. 20 of them are placed in the Elysium Basis group. They call it NRPT in this study. And 4 of those people are placed in a placebo group. Now, also, before we go any further, I do want to point out, if you have acute kidney injury or you have chronic kidney disease, realize that they excluded a number of people. They just didn't accept anybody. For instance, women who were pregnant were excluded, including also people who also had different types of cancer. They were also excluded from the study. And I point that out because if you have kidney problems and you're watching this, I do think it's best that you speak to your physician before taking dietary supplements to get the very best advice on what supplements may be appropriate for you. Okay, so let's move on and take a better look at how this study is structured. So as you can see, we've got 4 people in the placebo group. We've got 20 people that are placed in the Elysium Basis NRPT group. And these 20 people are then placed into 4 different groups. You have group 1, group 2, group 3, group 4, and there's 5 people in each group. The researchers also tell us the dosages that are in each group. So for instance, in group number 1, they're taking 250 milligrams of nicotinamide riboside and 50 milligrams of pterostilbene. You will notice the letters BID as well. BID is medical talk for twice a day. So what this really means is in group number 1, they took 250 milligrams and 50 milligrams of these supplements twice a day, which puts it at 500 milligrams of nicotinamide riboside and 100 milligrams of pterostilbene. And again, do the math for the rest of these groups. You also see below these that in some of the groups, they lost a couple of the patients. So they started out, say, in group number 3, they started out with 5 patients, they lost 2, and so they ended up with 3 people. And also over here in the placebo group, they lost half of the placebo group, which is 2 people. So they ended up with only 2 people. So it is what it is sometimes in science. That said, let's take a look at the results. So the first thing I'd point out is that they tell us that across the board, the Elysium Basis supplement, they're calling it NRPT, it raises NAD levels at all dosages. So all those dosages that I just showed you, all of them raised NAD levels in the cells. However, it was only the group number 2, or they call it step 2, only group number 2, where the NAD levels were raised significantly. And by significantly, they wanted to see at least a 50% rise in the NAD levels in the cell. So it was only the second dosage here, 500 milligrams of nicotinamide riboside and 100 milligrams of pterostilbene, which raised NAD levels clinically significantly. And the other thing I wanted to point out is that this dosage is actually more than what you're getting if you are taking the Elysium Basis dietary supplement. Now, on the plus side, the researchers report that Elysium Basis, NRPT, was considered safe and didn't have any side effects other than minor gastrointestinal problems, but they didn't deem that to be significant. And as for kidney function, well, the researchers reported that blood urea nitrogen, BUN, was lower after 2 days of taking the Elysium Basis supplement, and that's good. However, they also reported no significant changes in creatinine levels or glomerular filtration rate either. Those are two other methods of looking at kidney function. So little bit of a mixed bag here. Blood urea nitrogen apparently goes lower. They do not say significantly lower, but they do say it went lower. But the GFR and creatinine did not. Again, let's keep in mind that this was only a 2-day study. So if this Elysium Basis supplement helps kidney function, well, it may take longer to see a significant change. And so this study can't tell us that. It's just going to take a larger and longer duration study to figure this all out. But those were the main findings of this investigation. So a bit of a mixed bag. The big thing here is the dietary supplement is raising NAD levels and appears to maybe lower blood urea nitrogen, but after 2 days there was no change in GFR or creatinine levels. Again, we're going to need a larger study to figure out what all this means. So from this investigation, NRPT, Elysium Basis, seems to be safe for some people who have acute kidney problems, but let's keep in mind that this appears to be the very first investigation on this topic, and in my opinion, it's too small of a study to really understand what all this really means. And also, what about chronic kidney failure? We can't assume that the same outcomes would happen with chronic kidney failure until we do better studies. So, intriguing outcomes for sure, but hopefully future studies are going to do a better job at understanding and unraveling all this. So, do you take Elysium Basis? What do you think of it? Drop a comment below and let me know. Until next time, I'm Joe from supplementclarity.com. Take care.